So, hello again, it's Peter Cowley again. We've now got to the point where the data is available within the NHS to diagnose my particular type of cancer, which is non-small cell lung cancer, NSL, non-small cell lung cancer. Strangely, it's called non-small cell rather than large cell, but that's the way it is. I should point out I've got lung cancer, but I haven't. I'm as classed as never smoker lung cancer. I've smoked probably 25 or 30 cigarettes in my whole life, and the cut-off for the health system here in the UK is 100 cigarettes, and I've definitely smoked well under that. There are about 15% of people with lung cancer that have never smoked, and of course society tends to blame people who've got lung cancer for their smoking, which is very unfair. But the fact I've never smoked, so that's a subsection of the population that many people don't know about, that you can get lung cancer even if you've never smoked. So the diagnosis, the circulating tumour DNA had identified a specific type of mutation of the cells, which was of course in the lung, and had spread to the brain and to the lymph system and several bone sites and on my liver, on my adrenal glands. So there are about a dozen tumours, maybe 15 around the body, and some of the bone sites had already, particularly in the ribs, have already destroyed the bone. We come then to this visit to see the David Gilligan, and he didn't ask much before he brought out a disclaimer form. A disclaimer form which was, if we put you on this drug, you will, you're okay to do that. Effectively, I had to sign something, not naturally, to say that I was willing to take the drug. And it's called Osimertinib, or the sort of brand name is Tagrisso. It's a drug that was started to be developed by AstraZeneca back in 2009, so what's that, 13 years ago. And although it's got into patients in the States 7 or 8 years ago, NICE, which is our organisation here in the UK which decides what drugs should be paid for by the NHS, only okayed it about 3 years ago. So it's a fairly new drug. I've since, as we'll come to later, I've since got hold of the clinical lead from AstraZeneca, and he said there are about 500,000 people are either on the drug or have been on the drug. We'll come to why it's have been later, throughout the world. So it's a fairly popular drug, and it also turns out to be the drug that's making AstraZeneca at this point the most money. It's their best-selling drug of anything at this moment. So it's a targeted therapy, not a chemotherapy. It's a tablet, and it was designed so that it's a small molecule, which means it gets through something called a blood-brain barrier, because the brain tries to protect itself from things in the rest of the blood in the body by blocking things. This gets through, so therefore it works on the tumours in the brain. It's designed as purely a chemical formula, and what it does is to get on the surface of the cells, it will stop them multiplying. It effectively switches off their ability to multiply, and if they're not multiplying, they die off anyway. Cells die, have a life anyway, so therefore they're not spreading any further. The tumours aren't growing, there aren't any new tumours, and the tumours will die off. That's the theory, but at that point, of course, they also said that perhaps 15 or 20% don't respond to this correctly. We went through a long list of side effects, some very nasty ones, including heart problems, lung problems, and lots of smaller problems with dry skin and diarrhea and constipation, both those for some reason, and nail issues and etc., nose problems. All kinds of side effects. I've now been on this drug for 8 months, and I have been so lucky that I have so few side effects. I have a few nail issues, but a bit of filing does that. I've occasionally had a bit of dry skin. I've had 1 or 2 problems with my nose, but I've had none of the big effects at all. So I was shocked. I was really shocked at this point that there was a simple treatment for what is a very advanced cancer. And in fact, at the time, I didn't believe that it was possible. I've heard of stories of people who've been misdiagnosed even within Addenbrooke's or any hospital, I suppose, but particularly here in Addenbrooke's, and been told they're going to have chemo, and that changed their minds. There's no chemo, so it took me several days to accept that this was possible, that this drug would work. That was phenomenal. That was phenomenal thought. Anyway, before I could go on the drug, I needed to have an ECG done, so they had a baseline of what my heart was like in case there was a heart problem later. I needed to have some more blood tests. I also, which was really disappointing, one of the other side effects of the steroids, apart from putting weight on, was diarrhea. I don't know how those two go together. I managed to have terrible diarrhea and put weight on, and they wouldn't start the Tagrisso until that diarrhea had stopped, because otherwise it would just get flushed straight through, and it would be, the tablets are between 100 and 150 pounds each one every single day, depending on whether the NHS buys them or somebody else buys them. In the UK they're probably more expensive in other countries, and I know they're heavily subsidised by AstraZeneca in other countries. They're in about 40 something countries around the world now, this particular drug. So it took about another week and a half, 2 weeks before the Tagrisso, before I could start the drug. And in the meantime, the steroids, which meant I could walk, I still couldn't cycle. It took me another 10 or 12 weeks before I could felt comfortable on the bicycle. I had to get off that, and that's really difficult. The body needs to switch on its own production of this cortisol steroid, and it takes a bit of time. So I was on a sort of race between reducing, well, it wasn't a race, but I was trying to reduce the steroids. The Tagrisso takes 2 or 3 weeks to kick in, and I was in that sort of no man's land where I'd had all the negative symptoms and nothing really seemed to be happening. And I was still a bit unsteady, and I couldn't cycle, and I felt pretty awful, and that continued through for some weeks, probably. We're talking about the end of January here through till really the end of March before I begin to feel better. Anyway, I'll stop at this point. So again, emotionally really tough on everybody around me. Huge relief that there was some treatment that was targeted, and I've been very lucky. Of the 15% that have never smoked lung cancer, probably about 8 or 9% of us, 10%, have this specific mutation. There are other versions of this mutation where there are other drugs, the ROS1, the ALK, but the EGFR positive, that's epidermal growth factor receptor positive, if I got that the right way around, with a particular variation in the gene where I have something called exon 19 deletion. That means something's missing from it. This is all super complicated stuff that I don't understand. I'm an engineer and a software programmer from a long time ago. But I've got to the point now where I can start something, and we're only literally a few weeks, probably under 3 weeks from that first diagnosis. So I will continue again later.